Uh, so speaking of that, traditional psychotherapy, as you know, tends to be focused on one particular way to approach a patient. But unified psychotherapy seems to require that sort of dialectical thinking. Can you expand on dialectical thinking for us and its importance in a unifying approach to psychotherapy?
Sure. Yeah. Dialectical thinking has to do with the notion that a given phenomenon or process can be understood as containing two opposite poles in a sense. An example would be uh, psychopathology as one pole at end of the continuum, a person's health at the other end. And in a dialectic, you have these two dichotomous elements that comprise a given phenomenon. And in a dialectical view, comprehensive understanding of a phenomenon requires an understanding of both sides of the dichotomy and how they interact, rather than just focusing on, let's say, the person's psychopathology. Uh, in the case of the psychopathology health dialectic, when we're treating a patient in a unified view, it's important, of course, to focus in on their psychopathology. That's why they're coming in for treatment. They're in pain. They're having symptoms. There's impairment in functioning. They're having problems in daily living. And they're coming in for treatment of that. And so whether we want to call that psychopathology and problems in living, this is what they're coming in for treatment for. And that traditionally has been the view in different orientations. The emphasis has been on psychopathology, and that's still, of course, absolutely vital. It's the foundation of psychotherapy, is treating that. But a person also has pockets of health, strengths, assets, resources, and if we're really going to comprehensively understand an individual, we need to identify and understand their zones of health and their strengths and their assets. And we need to look at the person with both of those in mind, to understand their psychopathology, to understand their health, and in treatment, how to kind of address both of those and how to bring the strengths into play in treating their psychopathology, for example. So in a dialectical view, you're looking at the interaction of the opposite poles, of the two sides of a dichotomy. Another example of dialectical thinking and a unified approach is the dialectic analysis and synthesis, or the ideographic view and the nomothetic view. With dialecticism, you're looking at opposites, seeming opposites, that in fact, when integrated, create a unified whole and give a more comprehensive understanding of the phenomenon.